Hello and welcome back. This is part 2 of our 4-part mini-series. I'm Dr. Daniel Strom, a chiropractor and functional medicine specialist with Trites Clinic. In part 1, we discussed a few very important tests I believe should be run when properly evaluating cholesterol. One of those tests were to evaluate and to look at the particle size of your cholesterol. The reason this is important are there are tiny microscopic holes all throughout the arteries known as fenestra. It's when the cholesterol passes through these tiny holes that it becomes oxidized. It's this oxidized cholesterol that leads to cardiovascular disease, atherosclerosis, plaquing, hardening of the arteries, which can all eventually lead to heart attacks and strokes. So as long as your cholesterol are larger than these tiny microscopic holes, it is unable to pass through and become oxidized. Now, we still have to be concerned about our HDL and LDL ratios. But as long as that cholesterol size is big enough to not pass through those holes, we become less concerned with the total overall cholesterol number. Another test that we discussed was a genetic test looking at the ApoE gene. What this allows us to do is to tailor specific treatments to working with cholesterol and cardiovascular issues. To give you an example of how this can work is an ApoE2 gene responds to healthy, moderate levels of alcohol. What I mean by that is it can lower your LDL cholesterol and raise your HDL. Now, if you're an ApoE4 gene carrier, it would do the exact opposite. It would lower your HDL and increase your LDL. You see, there are hundreds of good things out there. But what's important is that you take the good things that can help you in your specific situation. So don't hesitate. Take a look and click on the link below or give our office a call. Stay tuned for part 4 because we have a special deal coming up. I'm Dr. Daniel Strom and part 3 will shortly be on its way.